I'm here with Dr. Leslie McClure, who is the Dean of the College of Public Health and Social Justice at St. Louis University and a professor in the Department of Epidemiology and Biostatistics. Dean McClure, what made you fall in love with public health?
Well, thanks for asking, Dean Goodman. I am a biostatistician, so my training is in math and then biostatistics. And I chose biostatistics because I wanted to be able to apply my quantitative skills in a way that had an impact on health. And it wasn't until when I was in graduate school and I really saw that biostatistics was an integral field in public health that I started to fall in love with public health itself. And I think the ability to have impact on people's lives in a meaningful way is what has made me really fall in love with public health.
Can you talk about when in your career trajectory that you knew you were in love with public health?
I think I fall in love with it all over again every day, right? Like, we're living in a crazy world, and I think that you have to love public health to want to be in this field. But I think it was really as I transitioned into my first job where I started working with real data and realizing it wasn't just numbers, it was really people. And I think that really made me fall in love with it.
How can biostatistics help uncover and address health inequities?
Well, biostatistics is one of the key ways to approach your data, right? So, I mean, what I love about public health is that it's so interdisciplinary. And so I can't do my job without my collaborators, whether they're sociologists or health equity researchers or autism researchers, but they can't do their jobs without biostatistics. And so we really are just a piece of the puzzle that helps unlock the secrets that the data hold, that the people hold.
One of the things I always talk about is that biostatisticians are narrators and we tell stories with the data. What's needed to bring in different types of people, more underrepresented folks, into data-driven public health fields to be different types of narrators?
Well, so I think the idea that statisticians, biostatisticians are communicators is really important, and that it's not just about math. And so I think that the better we can communicate that to people who are not traditionally represented in our field, the more likely we will to entice them to join us. But I also think having more representation begets more representation. So we just need to do better all around.
How do we balance data innovation with ensuring ethical and equitable outcomes?
Wow, that's a hard question. I'm the wrong person to ask that because I'm old. And, data innovation doesn't always produce better outcomes, first of all. I think we have to be careful that what we're innovating is actually improving what we're doing, first of all. But I think having the right team in the room, right? So biostatisticians are part of a team. We need health equity people in the room. We need ethicists in the room to have these conversations about what we're doing and is it ethical and how do we do it in an ethical way.
Dean McClure, I'm so excited that you joined me here for discussions with the Dean at the 2025 American Public Health Association annual meeting.
Thanks for having me. It was really fun to talk with you.